Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, I make videos about health and healthcare topics, and today I'm going to talk about natural family planning. Yes, today I'm going to give you 3 ways how you can control your fertility. You can opt to get pregnant or to avoid pregnancy by using these methods. These are 3 natural family planning method, and as you know, all the information given in my videos are directly referenced from the internationally accepted US National Medical Library, so you can trust the information.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Natural family planning is a form of pregnancy planning or avoiding. It does not involve machines or devices. Natural family planning also helps you to know when to have sexual intercourse without the risk of getting pregnant. It can be used if you are trying to achieve pregnancy also, or if you want to avoid pregnancy. This basically involves keeping a track of your bodily changes throughout the menstrual cycle. As a woman, you can do this. See, what happens is pregnancy can occur if sexual intercourse takes place right before or after ovulation. So ovulation is key. Ovulation is when the woman's ovaries release an egg, and it usually happens around the same time each month. So when ovulation occurs, the egg moves towards the uterus through the fallopian tubes, and this is where conception takes place. An unfertilized egg can actually live up to 12 hours. So your body will shed it during the menstrual period if it is not fertilized. So 12 hours is the main window of opportunity or risk as per your point of view. So there are basically 3 methods of natural family planning which are currently practiced. First is to observe the mucus, or which is also called as the ovulation method. In this, a woman checks and tracks her cervical mucus. During ovulation, what will happen? Your mucus will become stretchy, clear and sticky and sleek. Basically, it will look like and even feel like egg white, uncooked raw egg white. So you can just observe your discharge, vaginal discharge, and it's not just by observing, you have to write down your mucus consistency each day. Only then you will be able to compare. So that's one method of writing down your mucus consistency and checking for an egg whitish consistency for a stretchy, clear and sleek mucus. The second method is symptothermal method. Now in this, a woman can actually take daily basal body temperatures by using a BBT specific thermometer, a basal body temperature specific thermometer. They are little different. You can take the temperatures through your mouth, through the vagina, or through the rectum, through the anus also. A regular BBT is between 97 and 98 degree Fahrenheit. Now at the time of ovulation, your basal body temperature, your BBT, will rise between 0.5 and 1 degrees. Between 0.5 and 1 degrees. So you should take your BBT in the morning before you have moved out of the bed. Now when to take the basal body temperature is very important. You have to take the temperature in the morning before you have moved out, before you get out of the bed. Ideally, it should be at the same time of the day, and you should use a thermometer the same way each day to get an accurate result. The third approach is a rhythm method. It is basically on the calendar dates of a woman's previous menstrual cycle. This method can be more difficult and is not as reliable, right? It does not allow for the changes in the menstrual cycle, which are common. It will not work if your menstrual cycle are irregular, which are very common. So a normal menstrual cycle, which can be between 28 to 32 days, and at the day woman starts her period, is considered to be day 1 for cycle, and ovulation often occurs around day 14 of the cycle. So that's the third way. Sometimes people can combine approaches. That means they can use all three methods together. That's actually the best way. But in all three methods, you must use a calendar or a chart to track the data and the changes. This predicts when you ovulate. So you can actually partake or abstain from sex during that time. Now, there are some other symptoms which you may notice during ovulation, which you can even track. These include bloating, backache, tender breasts, and sometimes pain in your ovaries, ovarian region, lower sides. Now, you may choose to find someone who can help you doing the tracking, or you may consider asking your gynecologist for a recommendation or regular counseling. But know well, when you follow the natural family planning method to prevent pregnancy, the success rate is about 90%. So it's not bad. So when you follow this method to conceive, the average 2 out of 3 couples who don't have fertility problems will become pregnant. So know well, when you follow this natural family planning methods to prevent pregnancy, the success rate is about 90%. That's very good. And even if you follow this natural family planning method in order to conceive, to get pregnant, in that case also 2 out of 3 couples who don't have a fertility problem become pregnant. So that's also very good. So if you do not follow the instructions completely, then this method may be less effective. So what are the benefits? It's free, it's cheap, it does not involve any money as compared to birth control pills or condoms, and natural family planning does not have side effects. And the best part is, you can stop doing natural family planning at any time and it won't affect your menstrual cycle. On the other hand, natural family planning requires you to keep a constant schedule. So that is actually good for you to track your menstrual cycle, whether they are healthy or not. But yes, if you are not very careful or not paying proper attention, not keeping records, then you may not be successful with the natural family planning. So in that case, you may need to use a backup contraceptive. And if you have abnormal menstrual cycles, irregular menses, or if you are breastfeeding, then natural family planning can be unpredictable. So then that is very hard to do that. If you are already using a certain method of contraception and want to shift to natural family planning, before doing that, it's best to ask your own gynecologist whether there is any health condition that prevent you from using natural family planning. Then is it actually wise for your case to shift to natural family planning, and how long can you do that? And you can even discuss the cervical mucus consistencies, normal as well as during ovulation, with your gynecologist. So you should discuss these things with your doctor before shifting to this. If you are not doing anything, that doing this is better than nothing. So that's all about natural family planning. Hope you got the gist of it and hope you understood. And hope you liked the video. If you did, then don't forget to share this video to every single woman you know, and Don't forget to subscribe and hit the bell icon. Those who don't know me, I'm Dr. Paramjeet and this is my channel. I'm a consultant physician cardiologist in Yashoda Superspeciality Hospital, Nagar, Delhi NCR, and I make health and healthcare videos, all authentic and verified, top-notch videos. Don't forget to check out other videos, and I'll see you tomorrow, same time, same place. Stay connected, stay healthy.